So we've been in various states of lockdown and sequestered and not going to school or work or any of that things. We've gotten out of the habit of doing some of the things we normally do. And I can tell you for my kids, the 6-month checkups at the doctor and even at the dentist suffered a little bit there. So we've got a situation where the Virginia Dental Association is reminding folks perhaps they should get back into the office and have things looked at because hopefully you were not neglecting your oral health while you were sequestered away from other folks. And that's kind of the message is make sure you get back to doing the smart routine and I guess what auto mechanics would call preventative maintenance as well.
That's exactly right. Yes. And that starts both, of course, with your habits at home, regular brushing and flossing, which are, of course, as you mentioned, we're hoping everybody kept up with during their time at home and, out of the office. But yes, of course, that also means coming back to the dentist and getting back to the normal routine of your 6-month checkups. And yes, now is the time to make those calls to get back to the office.
One of the things we were talking about before we got started was, maybe a little push and a little crush of appointments right now as people do start to get back into the swing of things. And it's kind of a reminder, don't wait until there's some sort of emergency. Your ability to get an appointment may not be, hey, you're just sitting around waiting for me to show up.
That's exactly right. I think we're playing catch up for a lot of folks these days. We're finding a lot of our patients haven't been for their regular checkups in, 12 months, 18 months, 2 years at this point. And with so many people feeling more comfortable getting out and about again, having been vaccinated or whatever, it is just extra important to call your dentist, get on the list to get back in, because you're right, it may not be a quick and easy time to get an appointment.
So in your practice, any anecdotal evidence that you're seeing folks for the first time in maybe a little longer than normal?
That's exactly right. Yes. And a lot of people are in great shape and have been, taking care of their teeth and gums very well at home. Others, we do have a little bit more catch up to play in terms of getting their gums under, in better health, or even taking care of cavities that have formed during the pandemic. So yeah, just a little catch up on all ends. But I'd say by and large, most people are in fairly good shape. But you don't want to risk it. Rather get back to the dentist and have your dentist tell you you're in good shape than guess on your own.
One of the things I know that the VDA has been reminding folks, or wants to remind folks, is that there's been a change in benefits for some folks since maybe the last time they thought about going to the dentist or wanted to go to the dentist, especially for some folks on the lower end of the income level, that they now have an opportunity to have some of that stuff covered that wasn't before.
That's exactly right, and that is a very important point. The Medicaid, adult Medicaid now offers a dental benefit, which began on July 1st. So that's enabling a lot of Virginians to gain access to dental health providers that they didn't have before. And that is a great point and very important to mention.
So I guess the message here to folks is make that call, get that appointment, get back on your regular schedule as far as your maintenance. I don't know. There's probably better ways to put it, but I do think of it in that way, that preventative maintenance, to make sure that you're getting checked regularly. And even if you do have a problem, it's caught in the early stage rather than something else. A cavity, how quickly, if it's ignored, can become a situation where you need a root canal or worse. And, it's time to head back and to not ignore your oral health.
That's exactly right. I couldn't have said it better myself.
Anything else folks should know?
I think that it's just great to remind everyone, too, that there is such a link between oral health and overall health. We see an increased risk of cardiovascular disease and stroke in individuals with uncontrolled gum disease, periodontal disease. Also, diabetics, we see, there's a very close link between diabetes and gum disease. And when we get gum disease under good control, we can often get blood sugar and their diabetes under good control. So it's about your mouth, but it's about your overall health as well.
Dr. Batchelor, I appreciate the time so very much.
Absolutely. No, Carl, I appreciate your time too. And thank you and have a wonderful week.